This is Nan McKay, and I would like to introduce you to Robin Shapiro. Robin is the founder of several for-profit and nonprofit organizations, all having to do with health advocacy. She's a published author of The Secret Language of Healthcare: How to Ask for the Care You Deserve. She regularly gives workshops on topics related to health advocacy. So welcome, Robin.
Thank you, Nan. Delighted to be here.
Tell us what drew you to working in this field of health advocacy.
Well, I guess my career really has focused on two things as I look back. One is communication. So I have a degree in journalism and a degree in political science. But throughout even my education, I always focused also on healthcare. And I was always fascinated by people's choices, how the system works. And obviously, if you don't have your health, you don't have anything. Somebody famous said that, I don't know who. So that really drew me early on actually to working in the 1980s, if people were around back then. I was working, one of my first jobs actually, on the America Response campaign, which was the federal government's education campaign about HIV and AIDS. And in 1987, so the year before, Gallup did a poll about what was the greatest fear on the minds of Americans. And HIV and AIDS was the number one health fear. Because there was such a lack of information. And the government, seeing that, actually did something unprecedented, which is they developed a letter from the Surgeon General at the time, Sir Everett Koop, to every household in America about HIV and AIDS. And somebody you would all recognize also was in part of that letter, which was Dr. Fauci. So he was actually working back then, as a HIV/AIDS researcher. So anyway, that started me on my way to thinking about what could move ordinary people to make life-changing decisions based on education. That kind of started me off.
Well, you started just so well from thinking about that. What advice would you have for someone thinking of quitting their job today and starting a business?
Oh gosh, it was a long way actually from my first job to starting my own business. And so after I did that, I worked at a biotechnology company called Immunex, and I did a whole bunch of different things at Immunex. But the thing that I really loved was working with patients. And so I was inspired by a particular patient. And this is, you mentioned that I wrote a book, and the story also is in my book, but a woman who was about my age, who had been an incredible athlete. And then she was struck by a disease called rheumatoid arthritis, which is basically an inflammatory condition, mostly affecting women. And it basically robs you of your life because you can't use your fingers. You feel like you constantly have the flu, that kind of thing. And she told me a story. It really impacted her life, this disease. And she told me a story that, she had a baby and she had to diaper her baby with her teeth because her fingers didn't work, which if you're a mother, even if you're not a mother, you can imagine what that might be like. But with the power of a product made by Immunex, she was able to actually get the function back in her hands and her life and feel better. And so I was really moved by her story. And she had written into the company because she wanted to make sure, because she had been in a very, very bad place in her life. She had had a lot of pain and a lot of dysfunction. And she said, I don't want another person to go through what I went through, and I don't want another person to be on the edge of giving up on their life. And so that's why I want to share my story. And the power of that story really started me thinking about how to embed and include incredible patient stories. And that's really been my life passion. So when Immunex got purchased by Amgen, I thought about, I had the opportunity to pause right in my career and say, okay, what do I want to do with my life? I had a little bit of severance. So, and I had 2 young babies at home. And so I hired a friend of mine actually to help me think through, if I were to start a business, what would it be? And I loved working with patients. And so I founded Health Advocacy Strategies in 2002. And yeah, that was really terrific. So what I would say to people who might be on the edge of thinking about starting something is do it. Do it. It's, what do you have to lose? You can, I mean, it's a risk. And a lot of people are fearful. And there is a lot of challenge in starting a business, but it is so much fun and it's very creative. And if you're a creative, can-do person, being your own boss is fantastic. And creating things, I think, is just, it's a divine experience, in my opinion. I'm a very spiritual person, and I feel like being an entrepreneur is a little bit divine,
Describe some of the first steps that you took to create your new business.
Yeah. So one of the things that I did was I hired a friend of mine to actually take me through the process of thinking about what I wanted to create. And when I thought about it, I always think of space first. And it's kind of funny because now, almost 20 years later, where space is different than the workplace used to be. But I wanted to be in an inspiring place. I wanted to be surrounded by really smart people, and I wanted to be doing work that mattered to people. That was kind of how I started. And my friend Carrie, who took me through this process, had a whole list of questions. And that was really helpful. I didn't, she just interviewed me. I didn't have to write anything down. I just did it kind of off the top of my head. So it was much more of an intuitive thing. And then after that, I started to build a budget and think about, what I wanted to get out of the business and who I might go after. And those are kind of the first steps. And it was funny because the first day that I started, my husband called with my 2 babies at home. He's a stay-at-home dad. And he said, honey, do you think that you should maybe get an MBA? He was worried, right? He was worried. And I said, honey, this is my MBA. This is my MBA. And if it doesn't work out, we'll figure it out.
Well, I think that's a big risk that a lot of people are concerned about, is taking that financial leap. You talked about you had some severance pay. Did you also take a look at what is it going to take to sustain me for 6 months or a year, as well for our personal expenses? I'm thinking,
yes,
with your husband, a stay-at-home dad, that impacted you.
For sure. And so what I did was I looked at my savings, I looked at my severance, and we were very fortunate in that we had healthcare for a year. And so I said, I basically looked at what I needed, and I said, okay, I'm going to give it a year period of time. And if it doesn't work out, I'll do something else. And actually on the second day that I was in business, I had a former colleague call and say, hey, I heard you're starting this business, and a client called and they want what you did previously, and would you give them a call? So, sometimes the stars align like that, and the business grew from there.
How did you get your health care for a year? I'm trying to think what that's called, where you get it for a little while. Did you just extend that? I'm trying to think what it is.
Well, in my severance agreement, I had a year's worth of health care. So that was part of the severance. They were very generous. And, that safety net for me was really mentally critical, because I knew I had that runway. And I think for other people, you know, it might be a different amount of time, but don't ever underestimate the amount of time that it's going to take you actually to get up and running. And we see this a lot actually with people, for instance, who even go into the independent health advocacy business because they're like former nurses or doctors. And people who have never run a business before feel like, well, you know, I'm really great at what I do. So, you know, they think that it's just going to be overnight like that. And I think that people need to be kind of realistic about a slower on ramp than what you expect and more expenses than what you expect.
I think that's really, really true.
Yeah.
I think in my book, I'm advocating, look at maybe having enough to cover yourself for a year.
Yeah.
Because you don't know how long it's going to take to really get that traction. You're right.
Yeah. Well, and I think it's really important. I mean, I was also really fortunate in that when I started my business, I had one client in hand, and a lot of people start that way so that you're not starting from nothing. So I would say, and you didn't ask me this question, but I'm just thinking about all the, you know, entrepreneurs that I've mentored, is that before you make the leap, soft sound those people that could potentially be your clients in a way that is curious about what you have to offer. And I think that that's a really like no fail way to start, because you can say, hey, I'm thinking about this. What do you think about that? Do you think that, you know, this is viable? Do you know anybody who you think would be interested in my services? Or different services that, because you know me and know my skill set, that's a really great way to just get started before you officially kind of step out.
Yeah, that's really good advice. And you do have to be careful because you don't want to be promoting yourself before you get into it to place it. But you just did a great kind of segue into how people could do that.
Yeah, and you do have to be careful, especially if you you know, you have a steady job that you are kind of on the fence. You don't know if you're going to be leaving or not. But I think, you know, people should always be asking for feedback. I'm a big proponent that feedback is a huge gift from the giver. And so in my career and the people that I hang out with, are always saying, you know, this is what I did. Could it be improved? Could it be changed? What am I not seeing? And for somebody to be honest and give you feedback, that takes a lot of guts for somebody to be truthful, even when asked. And so I always say thank you, even if it's feedback that is hard to hear. That's some of the most valuable feedback, is the stuff that's hard to hear because it helps you learn and grow. You know, I mean, we all have our stuff and we all have our strengths. We all have our areas of improving, or maybe, you know, there are things that we're not good at or we don't like to do necessarily. And so, you know, after being in it for multiple decades over time, you kind of figure out, and if you're lucky enough, get to do what you love to do. You know, it's funny because the other thing about entrepreneurship is a lot of people feel like they have to do it all on their own. And there are advantages, obviously, to doing that, but there are also advantages to partnering. And so one of the things that I've learned over time about myself is I really like the start of things. I like to start businesses. I like to start organizations. And I think that I'm not as good on the strong growth part of it, because then I get a little bored or I'm thinking about other things. And so partnering with somebody who's really into growing things, scaling things, if you're thinking about businesses that can scale, don't be afraid to bring people into that part. It doesn't mean that well, at least this is what I tell myself, doesn't mean that you're not smart or not hardworking. It's just different people have different skill sets and different areas that bring them joy. And so I'm a big proponent of living in your joy and going after what you love to do.
I so agree with you. You know, I know exactly what you're saying because they call it the hunter farmer thing. And it's the hunters are the people that like to start the business and they get all enthused and everything goes great, but they just don't like to sustain it and do through the growth period. And
Yeah.
that is definitely me too.
Yeah.
Because I understand.
Yeah.
But let's talk about partnership for just a second.
Yeah.
I also know there's a lot of concern, liability, I don't know, whatever you want to call it, about formally going into a partnership. Are you talking about that? Or are you talking about just kind of helping out or what?
Well, I think you can structure it a lot of different ways. And my dad also was an entrepreneur. And so I was super lucky to see how his partnerships, because he had multiple businesses, in some instances were fantastic and in some instances were terrible. And so, what I would say is that if you are thinking about starting a business, it's really good actually to connect with other people who have been in business and have different arrangements around partnerships. And I am talking about legal partnerships, so that you understand, the pros and cons of doing a partnership 50-50 or different split. Sometimes there are multiple partners, but from a liability standpoint, partnership is like a marriage. And so it actually is a marriage, and it's like way legally a marriage. So, you have to think about what motivates your partner, and constantly being attentive to what motivates your partner in a business, I think is very essential for its success, just like in marriage. It doesn't mean that your partner's always going to get what he or she wants, just like in a marriage. But to be tending that very diligently is essential.
I think the other thing that is really important, and I learned this from one of the guests that I interviewed,
Mm-hmm.
is be very clear up front about who owns what.
Mm-hmm.
And if there is a split, then who is going to get what? Because she had the situation where she went through a patent, she went through the whole thing, but she hired a partner, took on a partner for the growth stage.
Yeah.
And then a year or two later, that other partner decided to get out and they wanted 50% of everything,
Mm-hmm.
but had not done a lot of the work.
Yeah.
And
that is, I totally agree with you. That's called a buy-sell agreement. So, and it's interesting because I've been part of different business roundtable groups. And so I've been just been so grateful to learn from so many people's relationships over time. And so this buy-sell agreement, when you are in partnership, is a really critical thing that you want to set up in the beginning. And some people say, oh, I don't want to, mentally think about if things go wrong. And that is exactly what you should do, because because I don't know what the percentage of successful or not successful partnerships is, but if you liken it to marriage, it's probably 50-50 at best. And let me tell you, I am an optimist. I've been married 25 years. I have an amazing partner of over 10 years in my first business. And I love her, and I love my husband. And we joke that we're spouses all together. And, but everything is not always roses, just like in a long-term marriage. That's impossible. So the real critical thing is when things are tough and rough and tense and hard, how is it going to be set up? How are you going to be? How are you going to help your partner meet his or her needs as well as your own, and make sure that the employees are safe and, your clients are in good shape. It's work. And if it wasn't work, that's why they call it work.
Well, let's go back to health advocacy a minute. A lot of people don't even know what that is. How would you really define health advocacy?
Yeah, like some people can't even say that word because it's so like, and it's kind of misconceived as this argumentative thing, but it's actually giving a voice to people who are navigating their healthcare. So I like to actually use the acronym USA. So it's someone who helps the patient understand their choices, support those choices, and assert their wishes. So USA, understand, support, and assert. And so this is just a kind of an emerging field that's just come up in the last 10 years or so as a paid profession. And it's really needed because when you're a patient, it's really difficult to hear information, make decisions, process things on multiple levels, and understand what the healthcare system kind of how it's set up and how choices are presented. Like most people don't understand that healthcare, even if a system is a nonprofit, is a business. And so there is financial incentive along the way. I just was listening to NPR this morning, and there was a story about a woman who went to the ER. She thought she was having an appendicitis, and it ended up being an ovarian cyst bursting. And she was there. She got 2 IV pushes. It was not there for very long, and got 1 imaging, and it was $18,000. And $18,000 for a young woman not yet graduated from college. So that kind of cost can, really change a person's life, right? And the point of the story is not what happened to her, but that with advocates, there are all kinds of different advocates. You have a better understanding of what your choices are to have a little bit more control. So there are even financial advocates who will go through your bills and navigate and negotiate your insurance with you. So anyway, it's a fascinating field. I feel very lucky. Yeah.
Yeah. How has COVID impacted the need for health advocacy?
Yeah. Well, I think, before COVID, most of us just bebopped along our lives and thought that getting seriously ill in a short period of time was for other people, right? Or older people. And I think what COVID did was really woke people up to the fact that you could be anyone and get really, really sick. You could be young, you could be any race, gender, ethnicity, economic area. I mean, certain risk factors, right, increased your risk for COVID. But the other thing is that COVID also changed a lot of the rules about how you make choices and navigate care. So some of your listeners probably know, because they were probably in the middle of things, that you couldn't bring someone into the ER with you, for instance. And so if you were having a really bad time of it, there was no advocate available to interpret what was happening, what your choices were. And so I think it really elevated this role and why it's so important, because a lot of people didn't have access to that.
That's a really good point. And then there were people that were in the hospital and dying that couldn't even do anything in any connection with their family, let alone advocacy.
Right. And it's interesting because HealthAdvocateX, which is the not-for-profit organization that I co-founded, because I'm based in Seattle, Washington, that's where the organization is based, and we were kind of ground zero, right, for the start of the pandemic. And we started hosting weekly community conversations with a board member who's medical director at Swedish Health Services about what was happening with COVID, and to help ordinary people understand what the real, skinny was, because there was a lot of controversy over what the facts were. We didn't have that when HIV and AIDS came along so much, because the government and everybody, we we immediately did public education campaign. We didn't have that in our country. And so there was a lot of misinformation and confusion out there. So if you go onto the HealthAdvocateX, that's like a x.org website, or YouTube, we have, I don't know, like 30 conversations about COVID related topics, some of them still relevant, like with long-term COVID with Dr. Vin Gupta, or Dr. Larry Corey, who was talking from the Fred Hutch, virologist, really smart guy, who is talking a lot about the basics of COVID and the vaccines and how they work. So we've been really pleased and proud to present this information to the public.
Yeah. Let's talk about your book a little bit.
Okay.
First, it's called The Secret Language of Healthcare, How to Ask for the Care You Deserve. I'd like to know.
I have it right here.
Oh,
that's what it looks like. Is that?
And it will be available from our website as well for purchase.
Oh, great. Oh, wonderful. Thank you.
I want to know a couple things. One is what led you to writing your book? And then the second thing is, tell us a little bit about writing and publishing a book today.
Okay. So what led to writing the book? So in health advocacy, we, through HealthAdvocateX and through the people that I meet, I'm constantly barraged, as you might imagine, with people who share their stories with me and who say, if only I had known, if only I had. And so these stories just kept on rattling around in my brain. And a lot of them were the same basic things that people really need to understand. And so what I did was I took 20 of the most basic areas in health advocacy that people need to know. And I included the personal stories of the people that I know and have met as an entryway. And they're dramatic stories. They're things that you won't likely forget. That opens every chapter. And then underneath that, for every chapter, I have why it's important, what's the history, what are the stats, and then additional information so that if people want to dig a little bit deeper, they have different resources and things that they can do. There's also like checklists of if you want to do something about this particular area, here's where to do. So, so it's interesting. I always, since I was a child, had on my bucket list, I wanted to write a book. And so anyway, a friend of mine who had written a book called me up, and he had done it through a woman who runs this organization called Bestseller in a Weekend. Alicia, I can't remember her last name at the moment, but anyway, he said, "Hey, I'm going on number 2 book. Come to LA and spend the weekend with me to do this bestseller in the weekend." And I, came up with every excuse in the book because I'm a busy person. I do a lot of different things. I'm like, I can't do it. It's too expensive. I don't have the time, blah, blah, blah. And then, but it got in there. Right. And I said, you know what? I got to do this. So I went and I drug 3 other friends with me. So we took over the weekend. It was really fun. And 10 months later, I had a book. So but I had help in that they have a very specific process that was helpful for me. And, with the artwork and the editing and that kind of thing. And I was really pleased with it. And the fun thing is, okay, so get this. So one of the things, I don't have the poster with me, but one of the things that you do during this weekend is you create a poster, okay, of the vision. I love doing the envisioning thing. This is a good one for people that start businesses or do anything, create a vision of what you want. And in the vision, I had a backwards arrow, and it was to my launch date, and it was the beginning title because I didn't have a title when I started, and it had where it was going to be and bestseller and all that kind of stuff. And my date was October 16th of 2019. And I did get it out there on that date. and it did go to bestseller on Amazon. And guess where I was on October 16th with the smiley arrow, which people might know is a certain company, large company's logo. I was at Amazon.
Amazon? Yeah.
I was at
Sounds like
Amazon with their staff. And my original title, actually, so this is even funnier. The original title for the book was Magic Words, The Secret Language of Healthcare. Okay. And I had a little wand. So I get up, and Nicole Bell is the person who is heading up the healthcare team there at Amazon. And I was delighted to be there on my book launch day. And she whips out a magic wand as I'm up there live. And she said, well, this is the first of our magic wand series. And I said, you've got to be kidding. But that just shows you that, if you think it can happen. So you got to be careful. You got to be careful what you think and put out there.
Oh, that's a great story.
Yeah.
Tell me, at the end of this interview, what are the 3 top actions that you would like somebody to take?
Well, I think for health advocacy specifically, number 1, never go it alone on your healthcare. Always have someone or some ones who you have on hand, who you shared your healthcare wishes with, who in case of emergency would go with you. So never go it alone. That would be number 1. Number 2 is everyone should have their healthcare advance directives done. So that's like if I am catastrophically and unexpectedly have a brain something happen, or get COVID or whatever, and I can't make decisions for myself, make sure that you have your wishes known and written down. That's like basic from the time that you're 16. And it doesn't mean that you can't change them, but you need to write it down. And number 3 is just constantly tending to yourself to be healthy. Most of us have some healthcare issue. In 2009 had a healthcare condition. I couldn't walk, and it was an inflammatory autoimmune condition. And it took a lot of years to kind of unwind that. And I'm happy today to say that, I manage through lots of tinkering in my life with food, with, mindset, meditation. And, you hear that and you think that's for other people. Well, when I was diagnosed with this particular condition, my rheumatologist said, this is going to change your life. You're going to have to slow it down. And I'm like, I have 2 businesses, that's for other people. And he said, okay, well, yeah. So I got taught a lesson big time. And so the third thing I would say is just keep tending, the small incremental ongoing things in your health really do make a difference over time. Don't give up on that.
That's good advice. What's your biggest tip for entrepreneurs today?
Well, what I would say is just do it. And I that sounds a little flip, but I think a lot of people, what holds them back are all the scary things about entrepreneurship. And there are many, it's a risk. But the other thing is, you only have one life. And so being an entrepreneur means creating what you see, what you want, where you see a need. The successful people that I've met who are entrepreneurs, they don't say, oh, I'm going to create a business to make a bunch of money. That is not the goal. They see a need in the market. They are passionate about making social change, and they figure out a way to do that. I would also say that, it's a wild ride. So where you start out is not where you're going to end up, no matter what. And so, again, it sounds a little bit trite, but the ride is the thing. There are going to be ups, there are going to be downs, but boy, there's nothing like it.
So what do you like best about your entrepreneurial lifestyle?
What I've really come to appreciate over time, the flexibility and freedom, and that, I always have a lot of ideas coming into my mind. And so it's really fun to be able to start and launch some of them and not say, right off the bat, no, I can't, I won't. I just let it all come in. And then, like I said before, soft sound ideas. And then think about also how I want to spend my time. Because as an entrepreneur, you get to choose. You can't do everything, so you're limited. That's a constraint. So, how do you want to spend your time?
Well, Robin, you have given us so much great advice, things to think about in both areas. The health advocacy area, certainly, lots of things that are important in writing a book, with your bestseller. And then over here, all your thoughts about being an entrepreneur. And I just so appreciate everything that you've given us. Thank you so much.
Oh, my pleasure. So delightful to share with you and talk with you today, Nan. I really appreciate that you create this platform for people to learn and share. So thank you. My pleasure.